It is one thing to treat one person and try and get rid of the pathogen in the body. It's quite another to deal with the pandemic and get the whole society to fight the spread of the pandemic. TB remains one of the world's deadliest infectious killer, and it's imperative that government, private sector, general population, labor, religious sector, traditional sector, youth, women, men, groupings, all of us together with general civil society must join hands in an effort to end this pandemic. It's important that we heed the call for a partnership in the fight against the pandemic, and I want to say we do appreciate the gesture of the TAC and all the PLHIV team that was with us this morning, who have made it quite clear that they want to be part of the solution, and we welcome that, and we're willing to also work with them as partners, because this requires the whole society approach. Despite significant progress that's been made over the last decades, TB continues to be amongst the top infectious killers, claiming over 1.4 million lives per year. And in South Africa, almost 50,000 people have succumbed to TB annually for the past 3 years. It's an undeniable fact that COVID-19 pandemic has disrupted not only our normal lives, but service delivery as well. The pandemic has negatively affected treatment adherence and uptake of TB services due to various factors, such as restriction of movement and fear of contracting COVID-19 in health facilities. The COVID-19 pandemic could also pose a huge threat to the gains that have been made. For instance, in November 2019, just a month before we started to hear about the coronavirus, excuse me, the novel coronavirus in Wuhan, China, the WHO told us that South Africa had reduced its TB mortality in HIV-negative patients by 19.6% for that reporting period. However, our view is that the progressive emergency response to COVID-19 should also serve as an enabler for our continued effort to eliminate tuberculosis. As such, we have highlighted the need to integrate our COVID-19 services with TB services to leverage off health systems and strengthening interventions that have been so effective for us in the fight against COVID-19. We believe that we have the infrastructure, strategies, and technology in place to beat the ticking clock and find the missing TB patients and bring them back to the system. And on this issue, we do agree with the marchers who came to raise that we need to focus on this, and they were prepared to be a partner in this kind of effort. As part of our effort to minimize the disruption on access to health services and promote adherence to TB treatment, we continue to encourage our chronic patients to make use of other safer, cost-effective and convenient methods of accessing their life-saving medication through what we call the CCMTD, the Centralized Chronic Medication Dispensing and Distribution Program, without going to the health facilities. CCMTD offers a simple, fast and efficient service for TB and other chronic patients to collect their medication from a wide range of safe and convenient medicine pickup points, saving time and reducing transport costs. And of course, as we say safe, it helps them to avoid being in places where they could easily be infected as we have the pandemic raging. Department, in collaboration with various stakeholders, including the WHO, will continue using a variety of platforms to raise public awareness around TB and to promote treatment adherence, regular screening and testing. Our catch-up strategy to ensure that we disrupt onward spread of TB in our community includes the following intervention, which provinces are already implementing. Demand creation through communication, social mobilization, and civil society engagement, integration of TB, COVID-19 and HIV services, strengthening airborne infection control practices in our health facilities, exploring innovations to ensure treatment adherence, delivery of TB medicine at home, or collection point convenient for the patient, remote or face-to-face adherence support and appointment system for follow-up visits. And leveraging COVID-19 digital health solutions for TB self-screening, contact tracing and screening, real-time surveillance system for TB notification and TB deaths, geomapping and hotspots identification for intensified response. Improving access to social protection for eligible patients. This will be guided by the results of the TB patient cost survey, and then lastly expanding eligibility for the latent TB treatment for all households contacts of TB, including shorter regimens for the treatment of TB infection. This was raised by the chair of SANAC, and it's an issue to pay attention to, and the need for us to focus on those shorter effective treatment, which is a combination of drugs that shortens the treatment to something like 6 months. I think it's important to ensure that we keep the adherence and the compliance by ensuring people can get treatment early enough. Also, the issues we have also, of course, been using the preventative, what is called the IPT, the isoniazid preventive therapy, which has also assisted to improve the mortality, reduce the mortality on HIV positive individuals, because of the fact that if you start early, then the treatment is improved. Of course, we have to intensify our work on not only just normal treatment for tuberculosis, on the drug-sensitive tuberculosis, but also to increase the recovery and the survival of people who are infected with multiple drug-resistant tuberculosis. We are quite aware of the concerns that have been raised, issues that have been raised about what we need to do to strengthen the partnership with various community structures. The need for information, which has been tabled here, we believe it is important to drive the campaigns, the advocacy campaign amongst the people who are part of the civil society bodies. The financing of the structures that support these advocacy programs, and in particular those who are actually helping to deal with issues of treatment literacy, adherence, and also the reduction of defaulting and increase the recovery. We believe that we need to do more work in this regard to try and ensure a very strong support from that particular area. The sectoral mobilization is important to deal with the issues of stigma, and also to make sure that tuberculosis does not get neglected. I think what we have seen, particularly from April coming this way with the lockdown, we were shocked to see the level of reduction at that point. And therefore, it's important for us to integrate all these platforms where we deal with tuberculosis, COVID-19, HIV, malaria. All of these are going to be very, very important. Another important point raised about extrapulmonary tuberculosis is also quite an issue that I think is important to deal with. In particular, if you look at the TB prevalence survey, that not only showed the high numbers of people who are positive, who test positive for TB, but that it's higher than what we initially estimated. But also it is showing that there is a lot more, much higher prevalence of tuberculosis on HIV negative individuals. Now these are people on whom our suspicion, our index of suspicion has been low. So it does call on us now to actually go all out to make sure that we widen the net to test, screen, and find more people with tuberculosis in order to be able to defeat this pandemic. Particularly the area of involvement of the men's sector. It's important as well, because I think has been said, the men tend to be the one who shun medical services, and therefore will only present if they are completely severely affected, or when the situation is such that they couldn't avoid the health services. So I think we need to look at the programs that can actually help us to popularize the screening, the testing, and the detection of tuberculosis amongst the males, so that we can deal with the problem that has been indicated. Of course, the extension of that to deal with those who are excuse me, in the immediate proximity. Now, the fact that we have had to deal with COVID-19 has also shown us the importance of the involvement of a whole lot of other pandemics that need to be attended to, such as the issue of gender-based violence and femicide. It becomes important for us not to leave any of these behind, because it's the same community. They must get the same message with all the issues integrated, and therefore they are able to deal with it. We note the issues that are raised in relation to equity in access to some of the basic services, some of the basic tools, some of the basic preventative modes of prevention, such as the availability of femidoms or female condoms. I would believe that's important to empower and emancipate women to be able to take charge of their own health, of their own body, and then their own health situation. We also believe that other issues that need to be given attention, the issue of infrastructure, poverty, unemployment, all of these are actually fundamental in the treatment of tuberculosis. Simple basic issue, having food in an empty stomach makes it very difficult. Then you end up with a problem of where people have got, particularly when it's still had so many tablets to take, you just get fed up taking tablets, and that becomes a problem. So compliance gets affected by those particular issues. And the issue of budget, we do note that, however, the real challenge is that the whole country is going through a difficult time. I think our resource constraints are actually affecting a lot of areas, and indeed it's not a matter of whether we believe that there is that health is an area where we can cut. I think it's a challenge that we have to deal with, as it were. But we do agree that we need to move speedily towards the establishment of our national health insurance, because universal health coverage will give us equity, will give us the social solidarity, will give us a kind of system, particularly strengthening our primary health care, so that the early screening, early treatment, early detection, and management of pandemics and issues where we need to mobilize community and make sure that people can get treated and screened early, it becomes very important. And these are some of the issues. And we agree that the foundation of economic recovery, the basis for economic recovery, is ensuring a healthy nation. So whether we're dealing with the issues of access to vaccine, whether we're dealing with the issues of treatment for TB, whether we're dealing with the issues of fighting HIV and AIDS, all of it has got a cost in terms of the economy of the country. And so it's important for us to make sure that these are taken care of so that we can create this healthy population that will ensure that we can then have the economic recovery. So our multi-sectoral response remains important in the fight against TB. We also want to thank all the multilateral partners that work with us and support us, from the UN family. WHO has assisted us for a long time. We've actually relied on their technical expertise, as well as UN AIDS as well. But also the US government, just as the point made by the Shajay, is that part of the mobilization for vaccines that we've bought. Some of the vaccines have actually to be collected from various countries to be available for South Africa. And on a continuous basis, we have to keep checking that those are available, and we actually have been informed that the last batch has been authorized to be released from the United States and a few other countries that have been able to release all these doses for us. So we need to continue to work together with the various governments that are supportive, the Global Fund, PEPFAR, and various other government agencies that are working with us. I think it's important, the important issue here is that at the end of the day, when you are sick, you are sick. Whether it's COVID-19, tuberculosis, or HIV, the main thing is to make sure that you get out of the illness, because there's no better death. No one must actually die of something that can be prevented. Similarly, the survival of people from HIV And TB also means we are certainly now going to face non-communicable diseases such as hypertension, heart diseases, cancers, diabetes, and chest or pulmonary diseases, and so on. All of these also need to be attended to. And so when we say the clock is ticking, we basically are saying that the tuberculosis is a preventable, eminently curable disease that we should actually eliminate, because there are others which are going to be much more difficult to deal with, particularly those non-communicable diseases. So we need to send a message to all our people that tuberculosis is curable, and that people must get tested, they must get treated, and then we must all together fight to end tuberculosis, and the clock is ticking, and no one must be left behind. At this point, colleagues and program directors, kindly permit me to introduce and invite the Deputy President to deliver keynote address. And of course, all of us would be aware, Honorable Mabuza hails from the province of Mpumalanga, and he was matriculated at Kuvula High School and also studied at Mgwenya College of Education. Later did studies with the UNISA, University of South Africa, earning Bachelor of Arts and other education certificates. In these days as a youth, I heard many people here talking about being young. We were once young at some point. Actually, you must know we're very, very active youth those days. And Honorable Mabuza was amongst those who was part of what was called the Azanian Students Organization and other youth organization, and later the South African Democratic Teachers Union, and then he became a teacher who taught in Gwangwane, under the Gwangwane Department of Education. And later then he became a member of the Executive Council in the government of the Mpumalanga province, and of course at the same time he moved to various departments, Department of Transport and others, and then also at the same time was a leader of the African National Congress, and the last he was the chairperson of the provincial chairperson of the African National Congress, participating quite aggressively in the issues of that organization as well, and ultimately got elected in 2017 as the Deputy President of the ANC, and then appointed by President Ramaphosa as the Deputy President of South Africa. Ladies and gentlemen, please rise and welcome amongst our midst, Deputy President, Honorable David Mabuza.
Thank you. Thank you very much. Is the mic working? Is it working?
Yes, it's working.
Okay.
Check one.
Program directors, MEC Sasekane Manzini, and Deputy Chairperson of Civil Society Forum, Comrade Soli. Thank you very much for the opportunity accorded to me. Minister of Health, Dr. Zwelithini Mkhize. Minister, thank you very much for the introduction, and I can see you have covered enough ground in terms of the issues that were raised here. Thank you very much. The Premier of Mpumalanga Province, Ms. Refilwe Mtsweni-Tsipane, Deputy Ministers in our midst, and members of the Executive Council of Mpumalanga who are here, our mayors in attendance, Deputy Chairperson of SANAC, Comrade Steve Litige, CEO of the SANAC Trust, Dr. Tembisile Kulu, representatives of the UN family, Dr. Owen Kalua and Dr. Mugabe, representative of the US mission to South Africa, Mr. Todd Haskell. Welcome, Mr. Todd. We are very grateful to be with you. And once more, congratulations for the elections. Congratulations to the brand new president, President Biden. We're looking forward to a very fruitful working relationship, and I'm sure you're going to enjoy your stay in the country. Representatives from business, from labor, and our broader civil society. Ladies and gentlemen, comrades and compatriots, today's commemoration of World TB Day is like no other in the recent past. Globally, almost all nations of the world are engulfed by the anguish and hardship of COVID-19, which continues to obliterate lives and livelihoods on a very unprecedented scale. The whole world is grappling to adapt to the ravaging impact of COVID-19 pandemic, to ensure that we contain the spread of the disease and try and rebuild economies that were decimated by the disruption of trade and disruption of global supply chains. Over the past year, governments have had to respond to the overwhelming demands of COVID-19 on a national health system. The capacity and efficiency and effectiveness of national health systems continue to be very strained by the waves of this infection, by hospitalization, and by deaths. Our people continue to die, even today. To some extent, national lockdowns and restrictions of movement contributed to the disruption of access to health services and the reduction in the number of TB detections as patients' contact and tracing services became more and more difficult during the lockdown periods. As a global community of nations, we are today commemorating World TB Day, fully aware and alive to the threats and negative impacts of COVID-19 on the fight against TB. This pandemic has the capacity to erode the achievements that we've made as a country, the progress achieved to date in the fight against the spread of TB. the potential diversion of priority focus and our financial resources away from TB programs to fund the response to the COVID-19 pandemic pose a serious risk to the consolidation of our global efforts to end TB. The deepening levels of poverty, deepening levels of malnutrition and unequal access to TB treatment and care may undermine our efforts to meet global targets to end TB. Today, we are reminded as citizens of the world that we have to act with a sense of urgency in pursuit of TB targets advocated in the Sustainable Development Goals, the World Health Organization End TB Strategy, and the 2018 Political Declaration of the UN meeting on TB. While challenges of COVID-19 will persist in the foreseeable future, we are encouraged by the progress made in the fight against TB. According to the World Health Organization 2020 Global TB Report, the number of people treated for TB has grown since the 2018 UN high-level meeting, with over 14 million people reached with TB care in 2018 and 2019. The number of people provided with TB preventative treatment has quadrupled since 2015, from 1 million to over 4 million in 2019. So there's tremendous progress. We need to consolidate and build on these achievements to enhance equitable access to quality and timely diagnosis, prevention, treatment, and care. As one of the 30 countries with high burden of TB, we are joining the world to galvanize our own society to realize that the clock is ticking. Let us find, let us treat, and let us end TB now. It is a theme that resonates very well with the call for global solidarity and collaboration in the fight against TB. Time is of essence. There is no room for complacency. We are calling on all our people to rally behind our national efforts to end TB and scale up our national response through urgently finding, initiating, and retaining TB clients in treatment and care. We should also work hard to regain those who have fallen by the wayside. Each and every one of us has a role to play in the fight to end TB. Our National Strategic Plan on HIV, TB, and STIs that was launched in 2017 remains even today our guiding implementation blueprint that enables multiple stakeholder participation and collaboration in the fight against HIV, TB, and STIs. In terms of this plan, we had targeted to diagnose at least 90% of all people infected with TB. We had also committed to treating 100% of those who have tested positive and decrease TB deaths by at least 30%. This year, the National Strategic Plan is nearing the finishing line. Yet the numbers in terms of targets that we have set for ourselves for HIV, for TB, for STIs remain stubbornly high. We have set for ourselves the target to reduce TB infections from 450,000 to 315,000 per year. Data from the recent TB prevalence survey indicates that 390,000 people became infected with the virus in 2018, just a year after the launch of the National Strategic Plan. Out of that estimated 390,000 people infected with TB, we only managed to find 60% of them that we managed to diagnose. This suggests that there is still a large number of them that are at large. They're infected, they continue to infect people out there undeterred. The survey also revealed that we had underestimated the prevalence of asymptomatic TB. Nearly 60% of people who tested positive for TB did not display any of the classic symptoms that me and you knows. This means we need to refine our case detection approach. To achieve this, we must work together as communities, together with our health facilities. The South African National AIDS Council remains central to all our national efforts in trying to mobilize various sectors of our society to ensure that we curb the spread of TB and eliminate infection. SANAC is the only tool that we have at our disposal, where together government and civil society can work together to end the spread of HIV and the spread of TB and STIs. Working with all social partners, community formations, and community leaders, government is committed to urgently finding, initiating, and retaining TB patients in the treatment and care. I'm very happy that today, as we sit here, we've got the men's sector in our midst, up and running. Thank you very much for all the efforts that you've put to build this sector. Today, we also have the women's sector in our midst. Thank you very much for all the efforts that you've put in building the women's sector. Today, we've got our youth sector. Thank you very much for all the efforts. We've got our people living with HIV, a sector on its own. They are with us, they are working with us on a daily basis. We're now ready, looking forward to launch the private sector forum. They're going to join us in this march. Through our Cheka Impilo campaign, we should ensure that everyone has the opportunity to regularly screen and test for TB at the nearest clinic so that they are initiated on treatment when they test positive. We're employing digital tools and platforms to raise community awareness and integrate TB and COVID-19 screening services. A TB health check mobile application that allows individuals to screen for TB risk and symptoms in order to reduce transmission has been recently launched. This mobile application is designed to make self-screening easy and efficient while also identifying individuals who need to get tested. It refers those who require a test to a public health facility for a free TB test. The system is integrated into Health Check, which is the Department of Health's COVID-19 digital self-assessment tool. I'm sure all of us must get acquainted to this tool. More importantly, our TB response also prioritizes communities in districts with the high TB burden to ensure that we contain the spread of the infection and turn the situation around. For instance, Ehlanzeni district, our host today, as we commemorate World TB Day, it's among the districts with the high TB burden in South Africa and has been one of the hardest hit areas by the disease. And I'm sure the province MEC and Premier will do something about this situation, mobilize all our partners, work together with all our partners to fight this disease. We're all here today to underscore the importance and urgency of the need to work with communities and all social partners in this district to ensure that we eliminate the spread of TB and save lives. In our last plenary, Premier, we urged all provinces, premiers in the different provinces, to take it upon themselves to chair AIDS councils so that they can, on their own, galvanize the support of social partners, work together with communities to confront these challenges of diseases. SANAC will continue to work with provinces and local structures to drive specific interventions in line with the goals and targets of our National Strategic Plan on HIV, TB, and STIs. So from time to time, we're going to visit provinces, we're going to work with provinces. SANAC has prioritized a number of interventions focusing on mobilizing targeted sectors of our society in response to prevalence surveys, reports, and trends. One of these interventions focuses on men's behavioral change. According to the results of the latest TB prevalence survey report, TB prevalence is 1.6 times higher in men compared to women. In this regard, SANAC men's sector has done very commendable work through various platforms in an effort to sensitize men about the importance of fostering health-seeking behavior. Until we reach and change men's attitude and perspective in every setting, we will never win the battle against TB. Men must change. We therefore call on all men across the country to be counted in the nation's effort to end TB. Unless men heed to this call, the well-being of South Africans will forever lie in the balance. Men must be encouraged to test for TB so that they get treated early before they spread within their families and the entire community. Notwithstanding challenges that we are dealing with, we are happy that we have set up a strong collaborative platforms with our communities as well as our local and international partners. We would like to take this opportunity to thank our international partners who have made contributions to making our HIV, TB, and STIs programs a success. Once again, thank you very much. To the UN family, thank you very much. We are grateful to work together with our global partners and donors, including the United States President's Emergency Plan for AIDS Response and the United Nations Global Fund for AIDS, tuberculosis, and malaria. We would also like to thank our local private sector partners who have made contributions in the implementation of our HIV, TB, and STIs program. Once again, thank you to our private sector partners. We need to continue to mobilize additional resources to fund our programs and broaden our footprint to cover more areas in the course of rolling out TB prevention programs. In this regard, I think we've noted your concern and comment, Deputy Chairperson, about the shortage of financial resources to pool our programs. To advance policy reforms that prioritize TB, will continue to enjoin the contribution of all public representatives and leaders, such as parliamentarians, legislators, traditional leaders, and healthcare workers. We are pleased with the progress made by the South African TB Caucus Secretariat in their efforts of establishing TB caucuses in all provinces of the country. The TB caucuses is a non-partisan country structure that forms part of the Global TB Caucuses, an international network of over 2,500 parliamentarians from over 150 countries across the globe who work collectively and individually across geographical divides and by engaging with civil society and other stakeholders towards ending TB epidemic. This work is very important in enabling legislators to advocate for the financial resources that we need towards the TB response and marshal policy reforms that enable the effective rollout of TB prevention programs. Across the world, we need to foster and deepen multilateral platforms of collaboration in the fight against TB. COVID-19 and many other diseases that are breaking out year in, year out, that are threatening human lives and threatening the collapse of our global economy. At the heart of this is the genuine desire to eliminate poverty, social disparities, inequalities in order to enhance economic inclusion and shared prosperity. The poor and the vulnerable sectors of our communities must access universal health coverage so that they improve their quality of lives. A human rights approach must always define the nature of global solidarity and cooperation so that together we build a better world, a world that is free from poverty and a world that is free from the burden of diseases. Let me take this opportunity to wish all of us very well in this journey. It's a long journey. The clock is ticking. We must take action now. Thank you very much. Thank you.
Well, that was Deputy President David Mabuza delivering his keynote address at the World TB Day Commemoration taking place in Mbombela.
The Minister and the Deputy President have responded in agreeing that indeed the clock is ticking. The spine should and end should be now. And indeed, I believe that together we will not fail. Let me allow Reverend